Borreliosis. About the borreliosis, is manifested by the Borrelia, the few pathogenic Borrelia. About the Borrelia it is the large spirochetes having lesser number of spirals. The most of the Borrelia are the common cells on the buccal and genital mucosa, and the few are pathogenic. The disease mostly caused by the Borrelia, pathogenic Borrelia. These are collectively called Borreliosis. About the Borrelia recurrentis, it causes the epidemic relapsing fever, the recurrent episode of fever. That is Borrelia recurrentis, the recurrent episode of fever. And the Borrelia burgdorferi, it causes the Lyme disease. About the relapsing fever, it is the recurrent episodes of fever. Why recurrent? Between the febrile periods, there is the febrile periods. It means when the high fever occurs for 3 to 5 days, and then between then temperature went to normals for 4 to 14 days, and again the febrile periods occur. Why? Because of the antigenic variation. The Borrelia surface antigen undergo antigenic variation. In each time when new antigen is formed which evade the immune system and causes a recurrent febrile episode, the antigen and antibody complex further causes the hemorrhages and the neurological dysfunction. The transmission of Borrelia occurs by an insect. On its basis, it can divide it into the epidemic relapsing fever and endemic relapsing fever. Epidemic, it is epidemic in nature, and the endemic, it is endemic in nature, caused by the louse carrying Borrelia recurrentis. And the endemic relapsing fever caused by the ticks carrying Borrelia species other than Borrelia recurrentis. About the laboratory diagnosis, the sample collection is the blood during the febrile state. If the sample is collected during febrile periods, then the microbes may not be, then the bacteria may not be present. And stain by the Gimsa stain, and microscope uses phase contrast microscope because they are poorly stained by the gram staining, and they are extremely thin. They are not seen under the ordinary microscope, so use of phase contrast microscope. And serology, about serology, the glycerophosphodiesterase, the most reliable serological method in which we detect antibody against glycerophosphodiesterase. And other serological tests are ELISA, indirect fluorescence assay, and PCR. About the Lyme disease, it is also a disease of borreliosis caused by the Borrelia burgdorferi, which is transmitted by a tick bite. At the tick bite, we find the maculopapular lesions. We call erythema migrans. And when the tick bite, the lesions form, and the Borrelia burgdorferi enters into the bloodstream. It homogeneously disseminated into the blood and causes secondary skin lesions, arthralgia, and neurological abnormality. If persist, then it can enter into the large joints and cause arthritis. We commonly call the Lyme arthritis.